Yeah, I'm based in Albuquerque, New Mexico, and I am the executive director of Casa de Salud, which is a nonprofit integrative clinic serving um, marginalized populations, as well as folks who are just really interested in a different model of care. I also work out in the Navajo Nation at a rural hospital emergency room, and do some national work around connecting people who are looking to build alternative systems of care and push back against what has become in some ways the medical industrial complex.
Yeah, and we're going to learn more about your work, understanding and all the history of the medical industrial complex, and that's going to be part of our General Assembly too. So we're excited to hear about that. I wanted to get into a little bit about what makes Casa de Salud different, and what I'll share with our audience is that you and I did residency together at Harvard UCLA, and one of my mentors and one of the ways I got involved in Doctors for Global Health was through Jyoti Puvula and Gilbert Granados, and that's really where I started to learn about community medicine and community health. And back when we were young interns and residents, I think that we saw, all the things that we wanted to do, and we also saw firsthand how broken the system is and how much it doesn't actually meet the needs of people and communities, and really isn't made, or it doesn't really work to keep communities healthy. And I remember us having a lot of conversations about what a dream clinic would look like, and I feel like you've done that. And so I want people to kind of understand what that journey was like for you, and what makes Casa de Salud kind of that dream come alive. I mean, I'm sure it's not easy, and I'm sure every day at work is not necessarily a dream, but I wanted to hear a little bit more and share that with people.
Sure. And gosh, that's so true. All the conversations that we had back in our residency program, which is a very intense time in our own personal growth, and just in terms of the intensity of work that we were doing in the hospitals and outpatient clinics. And that was really healing for me to have that space with you and with others to talk about what could a model of care look like that really serves community in a better way than existing structures often do. So I, and I need to be clear that I did not start Casa de Salud. I came into the organization years into its making, but there's a couple things that I think really stand out about it that are, for me, kind of core values, and always interested in talking with other people who are either building systems of their own or interested in doing something to transform their own system. This Casa just feels like such a gem in the ways in which we have nimble leadership, decision-making, a team-based spirit, and the ways in which we're funded, and the ways in which we're rooted in community, which allow us to respond to needs in the community and serve populations that are not as well served in other systems, and build trust. So some of our core values revolve around trust, dignity. There's a whole field of user experience, and there's a whole field within that of user experience in health system design. And without us really getting into having a user experience expert at the organization, without putting our heads together, listening to what people's feedback is about the experience, we've been able to improve at every step how we respond to the community, what our front desk even looks like, as the front desk is often a place of frustration or disconnect, or a barrier in many clinics, especially whether there's underpaid, overworked front desk staff, or whether people are treated differently just in general at the front desk, or whether there isn't language justice or the ability to communicate with people in their preferred language there. So design, trust, dignity, and really just being on the ground and being creative. And instead of working in systems that exist, we had the opportunity to really create and develop a system that we feel works for for our community. So we're a small nonprofit. We have maybe about 23 employees, of which 10 or 11 are clinicians of different kinds, and a base of volunteers. I'll talk about our health apprentice program also. And we very much value, as part of our trust building and our part of our healing work that goes beyond what I personally know as a Western medicine trained physician. We have physicians, nurse practitioners, PAs, but also have and respect the medicine of equally a doctor of Oriental medicine who practices acupuncture and herbal medicine at the clinic, a Reiki master, 2 massage therapists. We're bringing on a physical therapist and a dietitian and behavioral health components. So finding ways to make that work and really outwardly expressing to the community that we are here to work with people in all the ways in which they want to access health and healing, being culturally rooted in our community. We learn from what people want out of how they see their health and their healing, and work with them to build this system that works for them. We're in a 4,000 square foot clinic. We're not very big. And we really value integrative care and the medicines that we can bring from all different aspects to improve how people interact with health and healing in general, and provide, we see people for pain and we can support them outside of medications or weaning them off other medications or doing, expensive imaging and other things. We can often do a lot of high touch, relational, low cost things that rebuild their trust in the healthcare system and rebuild connection, and has humility built into it. We also work in terms of trying to fill gaps and serve patient populations that have not necessarily been served well. We're in the South Valley of Albuquerque, an area of Albuquerque that's very rich with culture, but also generally poorer than the other areas of the county, and in some aspects have up to a 15-year decrease in life expectancy than other parts of the county. And all of our staff speak Spanish. All of our volunteers speak Spanish fluently, being able to speak with patients in their primary preferred language. And then we also serve a lot of people who are dealing with opioid and other addictions. For New Mexico, heroin and opioid addiction has been in some ways a generational impact, with poverty and other issues coming together. And healthcare hasn't done a really great job of dealing with addictions. We've had a lot of stigma, a lot of morality, a lot of fear around how to work with folks who are dealing with addictions. And so at Casa, we're coming to it from a different place. We have a syringe exchange within the clinic so people can come and put in used syringes and get new syringes and learn how to use them more safely along with other equipment, but also have a really strong, safe, trust-building environment where if they want treatment, they can say, you know what, I'm ready and I don't feel fear around this, or I don't feel like you're going to judge me. And our addictions treatment program with buprenorphine or Suboxone is comprehensive, with evidence-based medicine treatment that's low barrier. You don't have to jump through 15 hoops and show that you really are dedicated in order to qualify to start on treatment. We don't make people arbitrarily do a whole ton of things, but we have opt-in things like an indigenous-based healing circle where people can reconnect around issues of mind, body, and soul. All our prices are accessible. We work with folks on Medicaid, so that's free for them. And we work with folks who don't have health insurance. And we have sliding scale fees up to $40 for a visit, and payment plans. And we never send bills to people's homes. We'll write off bad debt as bad debt if we need to, or find other ways to support that work. And then we have a base of about 30 student health apprentices a year who are primarily young women of color from the community who are interested in healthcare careers. They want to become clinicians, and they get hands-on experience up to 500 hours in a year as work-study students getting paid, or as volunteers, and learn how to draw blood, do EKGs, help clinicians with procedures do syringe exchange, work with people who are dealing with addictions in a dignified way, and they learn all these hard skills and soft skills that I know I didn't have a lot of experience in learning before I went to medical school. And then many of them go on to health professional schools and become clinicians. And we have hired some ourselves after they've become clinicians, and there's such a great dedication to serving the underserved. And we have a great dedication to diversifying the workforce and creating access points for populations that otherwise have a harder time getting into health professional schools because of structural barriers, not because of their worth or smarts.
You are talking about healing, and it's really rare for us in healthcare to even use that word. We talk about medical care, or it's just always this kind of scientific language. And not that it's bad, but it doesn't even really invite people to a place of healing on different levels. And you guys have completely broken that wide open. And one thing that I'm wondering, or maybe two things. One thing is, you and I were trained in Western medicine. We both have MDs, and we both went to US-based medical schools.
Mm-hmm.
How did you dismantle some of that so that you could get to where you are now, and co-create this kind of a healing space with the people that you work with at Casa de Salud? Like how did you get there? And what I have in mind is, like, how do those of us who are listening kind of find those places too?
Sure. Yeah, so I think I went into medical school being very, what's the word? Not maybe suspect of the extent and the limits of Western medicine. I know that in many ways our tools are limited, and in many ways our tools are pharmaceutical, or there are motivational interviewing and behavioral approaches, and there's coaching, and there's there's some, there's physical exam tools, there's all of these tools, and there's a lot of ways in which we do so much good in working with people, but it was so easy to see all the gaps that existed also. Like, you and I know how limited our ability to really treat pain is as Western medical doctors, and in medicine in general. From the 90s on, our profession has been involved in over prescribing opioids for pain for various reasons. And so thinking about, if you even take pain, for example, even thinking about pain and breaking it down, there's physical pain and there's emotional pain, and often they're tied together. We don't have tools to necessarily work through that. And we refer to other people that we have built relationships, like counselors and therapists and social workers and other folks, to work through some of those pain pieces. And then there's physical therapy, other options. But having in-house, in the same environment, other experts in other areas to work together was definitely a plan that the clinic kind of put together years before I came on, but it was so easy to fit into that, and it made so much sense. I have doctor friends who are like, gosh, I'd love to do a little bit of acupuncture here and there because there's these certain kind of symptoms or things that I might be able to help with, and they may go take some courses and come back and be able to do some small things. But I think in really trying to build a system that's different, it does require bringing all the experts to the table, and those experts are going to be oftentimes people who are not in the same field as you. Acupuncture is thousands of years old, and the way Chinese medicine comes to an issue with a person is very different from specific symptoms and diagnoses and specific fixes. And it's just been it's such an incredible experience working together with other practitioners. And I think in terms of building a system, it doesn't cost a lot to bring on healers and practitioners of different types of medicines. There is a piece where you need to figure out financially how you make this work. And I know in a lot of community federally qualified health centers, there aren't necessarily ways that work. They're not reimbursable. In our clinic, it's not reimbursable, but we make it work by intention and saying that the services we're going to split across and build these tools, and bring in these folks to do this work. And we've seen it. We've seen such profound improvement in people's health with the combination of therapies. We have people who have musculoskeletal pains, and they can get massage, medical massage, get that at the same clinic at a place that they trust, and be less triggered to take opioid pain pills, or I can't understate the power of the healing touch, which we in medicine don't do as much, and which is a piece of rebuilding trust. It's a piece of building connection, and it's a piece of treating people with dignity. So we have had patients in our addiction treatment program who've said, before coming to Casa de Salud, I felt like I was treated like an untouchable. I would be treated by doctors or by other practitioners, but I felt like they didn't want to come close to me. I could feel a stigma, but here I come in and I have hands on me at a massage, or an acupuncturist is putting needles in them, which is a very vulnerable thing for someone to experience and take in and also give out. Our Reiki master is doing energy work with them, and they can talk about what stress and anxiety and energy they have in a grounded way for an hour, which is so valuable. And we doctors can't always give that time. And so it just has been really positive. And I would love to see more systems which incorporate that really well. And I can guarantee that it's not high cost and the impacts are really great. The evidence is still being built around what can be done together, but there's so much anecdotal evidence. And I think really in our desire to, what we call, build power with community, build solidarity with community, follow the practices of liberation medicine, which also includes my liberation being tied up in the liberation of the community that I'm working with, that makes all the sense in the world.